Hey everyone, continuing with our series on the top 25 most common clinical presentations, we're going to talk about the check ear appointment, right? So that's usually what we get on our schedule. We get the check ear, we don't get the Pseudomonas, um, you know, chronic otitis with underlying hypothyroidism coming in as what's on our schedule at 11 a.m. We get the check ear or a possible ear infection, and we kind of work things up from there. So you'll have a tangible document resource too that goes into a lot more specifics about differentials and diagnostic options and treatment options. Just wanted to call out a couple things from that video just to 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 make these experiences a little bit more authentic in terms of just providing some pearls. And so the first thing is, and this might sound self-explanatory, but get for everything has to flow through an ear cytology. You have to get that swab and you have to actually lay eyes on what is going on. And so the sooner your team can get that ear swab going, the better. Even if you don't have a room available, but the pet is in the front lobby, have your team go up and get an ear swab and get that running, right? You just don't want to be in a position where you're getting behind or you're delaying getting ear swabs late in the appointment, because it doesn't work out well when you're talking everything through and at the very end you have a plan, but you get the ear swab back and it's different than what you had planned for. So get the ear swab early. I also personally, and this is every doctor's preference, I like to get those ears cleaned pretty much shortly after I've got a swab in hand from one of my team members. So get them cleaned so actually I can see down into the ear canal. I'm not usually too worried about seeing how much pus is in there as much as can I see down to the eardrum and like can I see how ulcerated the ear is. And typically if it hasn't been cleaned yet, I'm just looking down in there, I can't see anything, right? I can see that they're painful because they don't like me touching it, but I can't actually see the anatomy that I need to see. So I usually have my team, before I even get started, get an ear swab, get it run, tell me yeast, rods, cocci, how many, so you see neutrophils or otherwise, and get that ear cleaned out. That can be with, some brands that I like are, Tris Keto. It can be with, saline, Epiotic, a number of different ear cleaners you guys can kind of use, kind of just to kind of be protective behind the eardrum, but also kind of get that debris out so you can see what you need to. So get those things done early. And also, just in line with cleaning ears, I pretty much cleaned in the hospital all the check ear points that I saw, for the reason of a couple of things. One is compliance, right? Sometimes like the meds can't even reach down there unless we get it cleaned, and I'm not always sure that the owners are going to clean them well at home to get started. So might as well, for the pet's benefit, get them cleaned in the hospital before they go home, with the best chance of everything working out if we send home some topical drops. It's also worthwhile to do the ear cleaning in front of the owner. So demo how to do it. Have your team member demo how to do it. It also builds value, right? Because the important thing too is to charge for an ear cleaning. We've been a part of those ear cleanings that take a couple minutes, and we've also been a part of those ear cleanings that are like, I need extra hands, I need extra hands, I need extra hands, like, and all of a sudden it's not too easy. And so it's okay, and frankly it's encouraged to invoice for the office exam, invoice for the ear cytology, invoice for the ear cleaning. All of these things are beneficial for the treatment and diagnosis of that pet, and it's okay if they're all their own separate thing, right? So that's kind of one little tidbit that I had too. In terms of compliance, and you guys will come across this too, and you'll get a feel for, based on how infections are responding, and if you kind of feel like it's a limitation of the owner's ability to administer. But fortunately with ear infections, because they are so plentiful, there are a number of different ways to treat them, right? There are the shorter acting topicals that you're applying, BID or SID. There's the long acting ointments that, a number of different brands out there that can be applied for certain situations. So know that you usually got a repertoire of different things, especially if you're seeing a pet owner that you're going to anticipate having struggle administering drops, maybe because you guys in hospital struggled initially even getting the ear cleaned. Might be worthwhile just to mention just up front, like, hey, I've got this long acting ointment where you don't need to apply anything in the ear for the next 14 days. Hardly ever had an owner tell me no, because that sounds like a dream to them. So wanted to bring that up too. Another thing too, and I think in vet school for me, was kind of scared of steroids coming out, and I also didn't want to be the clinician practitioner that was always reaching for steroids and antibiotics, like what we had seen. And so, just shooting it straight, like steroids can be super beneficial for ears. In fact, I've gone to multiple CEs since graduating, and the dermatologist right up there is saying like you need to put these pets on steroids. If you've got a really painful, swollen, edematous ear, that pet likely needs oral steroids, and you might need oral steroids before you can ever put something in topical just to get that to shrink down and then recheck them so that way the ear canal's opened up enough to actually let drops reach where they need to go. So don't be afraid to use steroids. Not all of my otitis cases need steroids, but it's also always in the back of my mind as a really good option to give them. So I want to make sure that that was called out too. One of the last things I wanted to talk about was kind of going back a little bit to invoicing, and this kind of has to do with we see check ear appointments nearly daily, multiple times a day, and that's it's an important thing to kind of consider, like how are you invoicing for these when they come in, and how does that kind of implicate, like when it comes down to revenue for the hospital and also take home revenue for yourself, production revenue. So take, for example, you've got one vet for the routine ear infection that does their $50 office visit, their ear cytology for $30, and then sends home medications, right? Not a bad system, right? That's probably gonna generate right around the $120 dollar range, versus myself, like what I took ownership of is that I saw a ton of value in doing all three of those things, but also doing the ear cleaning in-house because it was of value to the pet owner. I usually could give a demo for them so they could see how to clean at home. It was better for the compliance of that pet, and I also knew that if I cleaned them in-house, that pet had a better likelihood of success of actually treating the infection too. And so I invoiced as well for the ear cleaning. If it took me a couple minutes, or if it took me 10 or 15 minutes to get that done. And so all of a sudden my check ear appointments are now generating on average 150 or more, right? And so just thinking about, like $30 difference for one appointment, not a big deal, but if we're seeing multiple of these a day, a dozen of these a week, think about that over a month, think about that over a year, and how the revenue can look very different just based off clinical decision making and what we're invoicing for between two veterinarians that are seeing the exact same patients. And so have that in the frame of your mind, especially when you're looking for areas of growth from like a production revenue wise, or your hospital's looking for areas of revenue growth wise. Look at your common appointments and how you're handling them. What's your foundational protocol of how you handle like check ears, and what can I build into them that's best for the patient and things. Or maybe I'm already doing the ear cleanings and it just comes down to I need to invoice for what I'm doing, right? So making that simple jump of let me charge for what I'm doing, because I don't want to have to resort to seeing more pets or working longer hours. I actually just want to be invoicing for what I'm doing and not have to work harder, just work smarter. So a couple of my caveats, but hope this was a helpful video for how to approach the check ear.